Hi, quick check-in. I had my surgery on Monday, June 12th. Early in the morning, I was the first one in the morning. Dr. Sheila Partridge did a great job changing my vertical banded gastroplasty to vertical sleeve. And I woke up, not a whole lot of pain. And the nurses were really great to get my pain level down. That's one thing I recommend is make sure that you ask to get the drugs that you need to get the pain down. And you also have to keep keep track on when you should be getting your meds, because a lot of times those nurses are so busy and so busy with other patients that they don't have, that they might miss your window for when it's time to get more Tylenol or something like that. So I found it very useful myself keeping track and asking them before the pain came back, because pain is always, any kind of pain is more difficult to get rid of the more intense it is. So like the nursing staff thought that I was just a wonderful patient, and everything went beautifully well, which I'm thrilled with. But I think a lot of that has to do with me being proactive around my pain management, because I really wasn't in that much pain, which made it easier for me to walk around when I needed to walk around, and to follow the directions and use this stupid little breathing exercising thing. One thing that I did do, because they forgot really to ask me. There are a lot of things that the nursing staff forgot to ask, but because the program, we had a meeting before surgery where Dr. Partridge's office had a nurse talk with me, and then there was a group class for 2 hours about the blended diet afterwards. So they put in a lot of effort to make sure that I knew what should happen, which I'm glad, because the nurses there aren't all on the same page, and there are certain things that they really want, that my practice really wanted to have done in a certain order, etc. So I found that very useful. And what else? One thing I really wasn't expecting was like all the different doctors. So besides my surgeon, so really there was like the head nurse, who she's basically tracked my progress from the time that I went into the hospital through the screensaver, haven't figured that out yet. Through the time that I left. And she is kind of like the consistent touch point. Even though I had different nurses every day, she would check in on me every day, and she really knew her stuff. She was really good. And she was kind of very much like the mother figure, like, you need to do this, and you have to do this, and make sure that you've done this. Like, you need to have walked 2 times today. Do 2 laps today. You need to be able to get this down. In order to leave, these are the things that you need to have done. So she was really good at being very clear about those things. And then the daily nurses were really good about, that's really who was taking care of my pain management. And then there were like the interns that came through. They're like a group of 3. And I think it might have been like an intern and then a medical student. And I was kind of buddied up with a medical student, which was kind of nice. Like the medical student, she was a 2nd-year medical student, and she was like my buddy throughout the whole thing too. And where the surgeon can't she's busy doing surgery. She doesn't really have the time to devote to every patient that she has surgery on. But this medical student did have the time, and it was nice. And if there was something she didn't know, she would go ask the surgeon, or she would find out. And she was very knowledgeable, very nice. And while, you know, I'm like, oh, it's a student, but still, I get it. And it was nice having the extra touch point, you know, the extra person there. She would look at my band. Everyone looked at everything, right? So I knew I was getting good care, which I did get good care. What else? Because of my revision, I did have a, what do they call it? Like a extra pack, a little drip pouch. So they would all check that and empty it, and the student took it out at the end, which was fine. It was not painful. It was just really weird. It was like the feeling of if you have like a hair stuck down your throat and you pull it out, it's like uncomfortable and queasy, but it didn't hurt, and it was over in like 5 seconds. So that wasn't a problem. What else? That is it for the most part. Let me show you my incisions real quick, and we will call it a whatever this is. We'll call it done.